Hello and welcome to this micro education video on how to set up a clinical IR service. My name is Federico Collettini. I'm an interventional radiologist here in Berlin at the Charité University Hospital. And over the next few minutes, we will walk through the aspects that, in my opinion, are the most important to set up an effective, sustainable clinical IR service. To do this, we will use MSK embolization as an example. First, start with a need assessment. Define the procedure and clinical offering clearly. Define the scope of your clinical service, the evidence behind your treatment, and the resources you need to bring this therapy to the patients effectively. Assess your target population, demographics, clinical characteristics, but also referral sources are important to design your clinical service effectively and ensure effectiveness and safety. Evaluate service gaps and unmet needs, knowing the strength and the limitations of available conservative and surgical treatments can help you to pose the right indications and bring your therapy exactly where it's needed. One very important thing is to engage all stakeholders from the very beginning. This is crucial for long-term success. Each of the stakeholders will bring unique needs, priorities, and constraints, and you have to talk to all of them to ensure sustainability and long-term success of your clinical IR service. What are the core elements of an effective IR service? First of all, multidisciplinary integration. The interventional radiologist must be seen as a clinical partner, not just as someone who is performing the procedures. So make sure that you are present. Attend the tumor boards, the multidisciplinary meetings, discuss the cases with your referring physicians before and after the procedures, and be sure to be an active part in clinical decision making and not just someone who is performing the procedures. Clear referral pathways are extremely important to ensure an effective IR service. So develop protocols and pathways for the patients with your referring physicians. This will enhance your everyday job and will also enhance the experience of the patients in the hospital in your service. Dedicated facilities are extremely important. Things like an IR outpatient service or even an IR ward will enhance patients' experience and also increase patient safety and satisfaction. Patients need to have facilities where they can present before and especially after the procedures to discuss their improvement or the non-improvement with the treating physicians. Prioritize quality improvement and data generation. Standardize your procedure, track your outcomes, and generate your own data. This not only improves your care, but also builds credibility and visibility for you and your service in your clinic. Perhaps the most important thing, your team is your greatest asset. A dedicated and motivated team is the single most critical ingredient for success. So invest in their training, support their growth, and celebrate your wins together. Thank you very much.